preparing. It says it's now streaming live. Looks like we are good to go now. Thanks for hanging in there, everyone. And a very good afternoon, whatever time it is, from wherever you're located. Just waiting for my video to show. All right, can you, yes, no, I think we're all caught up. Hello, hello, hello. A few technical glitches, but we've got through it, everyone. Fantastic. Thanks for your patience, everyone. All right, so broadcasting out of Brisbane, Australia on the East Coast. It's 4 p, just gone, it's 4:40 now. So hello to wherever you are and whatever time it is. So just share where you're located, everyone. Hello to Madhu over there in Perth. Hello to Gray. Hello, Nadra. Wherever you are, welcome. I'll just wait for all these messages to come up. All right, and as they're coming up, I'm going to change this screen, reduce my size, and we're going to go over onto our PowerPoint there, our presentation slide. Just bear with me, everyone. There we go. That's our share screen there. I think you can see. I'll just get myself organized at my end, everyone. All right, and I'll try to keep up with all your comments, and we'll make this a nice interactive session. All right. Okay, just checking your comments there. Make sure I can see what everyone's writing. Okay, let's get started, everyone. We're going to work on a live writing correction. So if you're ready to go, just type in, ready to go, just type in R2G. Type that in so I know that the comment section is working. Hello to people in Melbourne. Hello to Narit down there in Byron Bay. We'll have plenty of time for questions, Rashid, as we go through. All right, good. I'm getting comments. All good. Excellent. All right, and I'll try to keep up with all those comments as we go along. Okay, so we're going to start, everyone, by looking at a set of case notes. We're going to start with medicine. So what we're going to do now, we're going to cover 2 sets of case notes, and we're going to do some live writing correction. Someone's already asking, how can you join our online course? You just visit our website is all you need to do. If anyone wants to know our website address. You can find it. Just a moment. Oops, I've just lost my thread there again. Internet's a little bit slow. And there it is. That's the link to our page, everyone. Okay. All right. So we're going to look at writing. Now, the task we're going to look at today, everyone, is on the OET Centre website. It's a task about a woman called Priya Sharma. Doctors, you might have seen that before. So that's the task we're looking at, but you can find this task on the OET Centre website under their sample task if you wish to look at that. So what we're going to do, we'll just go through it, and then we're going to look at a letter and correct the letter that someone's written. Okay, so always read the notes, everyone. It says here, we've got a little note section. It says, Miss Priya Sharma is a patient in your general practice who is concerned about her glucose level control. So we know what the issue there is, everyone. A patient concerned about her glucose level control. So that automatically tells you what you're going to focus on. And if we scroll to the bottom, it says it's a referral letter to an endocrinologist requesting management of the patient's sugar levels. So it's very much a case from a GP to an endocrinologist, and the focus needs to be on the patient's sugar levels, and I would say history of diabetes. So let's see what we know. We got the patient details. She's 60. She's married. 3 adult children, 5 grandchildren. She's retired. Okay, we can start to see a few things that may not be really relevant to her case. She's got a family history of diabetes. That seems very relevant. We can start to cross out a few things to give us focus. She's got a medical history of diabetes. But then we've got some sections here that she's allergic to penicillin. She had a menopause 12 years ago. Never smoked, nil alcohol. Probably could remove all that information. No other prescribed medication. So we're just focusing more on the diabetic related history here. So probably exercise may have a relationship or may not, but certainly the medication she's taking. As we go through, she visited the GP clinic on the 29th of December. She was concerned about her glucose levels were not enough well controlled. Someone's asked me to zoom a little bit. Can do just a little bit there for you, Patch. But hopefully you're using a laptop. Be a little bit small if you're on a phone. So there was a discussion on the 29th of December. She was concerned that her glucose levels are not well controlled, and she's worried. She attends a health centre, and she feels not taking her concerns seriously. So a bit of anxiety there. And then recent blood sugar levels, 6 to 18. She checks it at home. She had an eye check in October. It was okay. Weight steady, BMI 24. Appetite good, good diet, bowels normal, micturition normal. So, and the full examination, no abnormalities detected. That's NAD. So quite a lot of history that seems quite relevant. BP 155 over 100, no peripheral neuropathy, pelvic exam not performed. So there'll be good information to include in your letter there. Pathology was requested, various tests were requested. Doctors, this would be right up your knowledge area. And the review in 2 weeks. Then there was a review that came and the report was received, and then we get the results. So there's the results. And you can see high cholesterol and the high HbA1c, 10%, so indicating very poor control. That seems very significant. And then there was a review shortly after, and medications were changed. So that seems very relevant, and a new medication added. We keep scrolling through and we can see that over time, her home BP was in range, sugars improved, so there's real progress there. And then on the 6th of the 2nd, the pathology report was received and the cholesterol was back to normal and things were a lot better. So always important when you're reading case notes to link and make connections between the history. This will help you avoid repetition, which you'll see in a moment. And then pathology report reviewed, and the fasting sugar, though, was in the high range. So there's a problem there, and other blood sugars were 7 to 8, and it's referral to the diabetic unit for further assessment. Okay, so that's our task. How would we write a letter like this? Well, here's one person's done a letter for us. Let's see how they did. Now, I've flagged a few errors, and I'm going to ask you in the audience to see if you can help me correct some of these errors. So it's got the date, who we're writing to, dear Dr. Smith, re Mrs. Priya Sharma, got a date of birth there. And it says, I'm writing to refer this retired 60 years old lady with poorly controlled diabetes who requires further management of her blood sugar levels. Looks like a pretty nice introduction, everyone, with only one mistake. Can anyone correct that mistake for me? You know what's wrong there? Just type it in if you can tell me what that is. But I'm going to tell you this is a good introduction overall with just one mistake, because we've done a few things here. We've identified the patient, a 60-year-old lady, and a retired 60-year-old lady. So that's current. That's quite good. We have stated the chief complaint, we'll call it, or the main issue. And we've also put the reason for writing, the reason for the referral. So we've ticked everything off there, and there's just one mistake. So we've got to fix that. So when we correct writing OET Online, we'll just correct it there. And it says, as year is part of a noun phrase here, do not pluralize, do not use plural form. So that's corrected. That's a common error, nice, easy one. But otherwise, it's a very strong introduction, everyone. It's a really good introduction because it's got a great focus. All right, let's keep reading. Mrs. Sharma has suffered from type 2 diabetes for 20 years. Now, there's no real grammatical error there. There's no real grammatical error there. But what do you think of that expression, has suffered from type 2 diabetes? The word has suffered indicates that the patient is really struggling and suffering and having a lot of difficulty. And those difficulties have been ongoing for 20 years. But is she really suffering? This is the question. And a lot of people actually say, well, that's not the best way to express it. So you might just say, we can correct it like this, has had type 2 diabetes for 20 years. So let's remove the suffered because it's a little bit emphatic and we simply want to just give the fact she has had it. We could also give another option. We could say 20-year history of diabetes. That would be another way to write it. Yes, Simma says judgmental. Yeah, it's kind of in that direction. Yeah, it's not quite judgmental though. It's just more that you're implying that she's suffering and she may not be. But if it's pain, suffered from severe lower back pain, that would be considered quite acceptable. So it depends what you're describing. All right, let's keep going. She attended to my clinic. Now, here's a classic error I see a lot. You know what's wrong there, everyone? She attended to my clinic. So attend to has a different meaning. Attend to equals, it's like attend to the patient, care for, or look after the patient. So this is a vocabulary error, whereas simply attend means visit. So just by adding that little preposition, that phrasal verb, everything changes. So we've got to get rid of that, cross it out. She attended my clinic on this date with concerns about, this is an easy one, everyone. Concerns about, we just put in the pronoun, her blood sugar level. Her blood tests confirmed a high HbA1c level, 10%. As a result, metformin dosage has increased. Now there's an error, everyone. You know what's wrong there? Has increased from 500 BD to 750 BD. Now we saw that. Somebody increased it. The patient can't increase their own medication. So it was increased by somebody. So we need to make this a passive. You know what goes here? How do we make a passive? As a result, metformin dosage has, can anyone type this in? Thank you, Mohammed, over there. Has been increased because somebody increased it. So we put a little comment there when we're correcting and just put in use passive form. All right, but otherwise this is quite a good paragraph, just a few things we picked up. And it says her glibicide has remained unchanged. However, her latest fasting blood sugar level showed a high reading. So I have a question. What's the topic of this paragraph? What's the topic of this paragraph, everyone? For me, it's a focus on what? On the diabetes, isn't it? It's a focus on the diabetes and the medication. All right. Then we've got another paragraph. During something visit, I'll put this in for you. During the same visit, she was diagnosed with hypertension and hyperlipidemia, for which she commenced on, there's a mistake here, everyone, as well, for which she commenced on candesartan and atorvastatin, respectively. Today, both problems were brought under control. That bit's okay. Again, we need the passive voice here, don't we? What do we put here? For which she was commenced, yes. For which she was commenced on, that'll fix it. So this writer is having a bit of difficulty with the passive, but we fixed it now. I'll just fix it in red. And then today, both problems were brought under control. All right, so this is a focus on the other issues. Okay, let's continue. She had a strong family history of type 2 diabetes. Had a strong family history? What do you think about history? Is history past or present? Can we erase our history? Or do we always carry our history? Can we delete our history? Doa says we can't. So yes, use present tense here because history is always present, never past. So has a history or has a strong family history in this case. Oops. She has a strong family history of type 2 diabetes. Therefore, she is health conscious about her diabetic control and attends the health centre regularly for checkups. Up to this point, her renal function and eye condition have remained normal. So some background information, everyone. This is the background. It's going at the end of the letter. Useful information for the endocrinologist, but not the main issue, but connected to it. And then I would appreciate if you can, now we've got to balance out polite verbs here. This is an easy one to correct. I'll do it for you. I would appreciate if you could provide specialist care and treatment. If you require further information, do not hesitate to contact me. And look, it's just 181 words, so very concise. All right, so let's see what we think about that letter. If you submitted a letter like that, what sort of score would you get? Well, the OET Centre use this criteria to grade you. So you've got the 7 criteria. You've got purpose, content, conciseness and clarity, genre and style, organisation and layout, and language. Now, I'd say I would give it good marks for the purpose, because as what I said before, it had everything you wanted in that purpose. It was very good. I would say that the content is also strong because it has a strong focus on the diabetic related issues. I would say conciseness and clarity, very good, because it's a short letter. It's only 181 words, but it hasn't included any non-relevant information. And the way that it's ordered, the main issues that the endocrinologist needs have been expressed very clearly. Genre and style, again, it looked quite good. Maybe losing a bit of mark for that word suffered, because in terms of genre or style, that's not quite right. So, and then didn't use polite form down the bottom. So probably going to lose a mark there, more in the satisfactory range. Organisation and layout, I believe, is very good. And there were some language issues. So that would be more in the satisfactory range, actually quite a few. So we might even say on the lower end there, or perhaps even at this end. Now remember, because of those errors, this probably wouldn't get 350. It might go a little bit under because of the language, but everything else is good here. So this is actually a good letter. And I'll just let you know, it's just some grammar mistakes that anyone can make. But it's very good in terms of organisation. It didn't follow the chronological order exactly. It actually did a subject-based approach. One very clear introduction, one paragraph all about the diabetes history, and notice how it was all grouped together. So all the way through to her latest reading of 16, all the information was presented about diabetes in one paragraph. What do you think, everyone? Easy to read? I think it's easy for the endocrinologist to read and understand her diabetic situation. Then there was a paragraph on other factors, which is very relevant. And then finally, the bottom paragraph was on past medical history. All right, so there you go, everyone. Corrected, very close to B. And I would just tell this student, just review grammar. All other aspects are very strong. If you improve your grammar, this person will be able to get that B score, because it's a very good letter. Just a few language errors. What do you think, everyone? Did it look good to you guys? All right, let's go to another one now. Let's do nursing. But before I do, any final questions on that task? If it's all good, just type in AG, everyone. AG for all good. Jai says, can we write the patient attended me? Sounds a bit funny because didn't actually attend you, attended your clinic. So I wouldn't say that, Jai. Thanks. Oh, yes, someone picked up a mistake. Who requires? Sorry about that one. I missed that one. Yes, verb subject agreement. So that should be who requires. Thanks. I missed that one there. Well spotted. So the verb subject agreement is incorrect. Daniel says, how many mistakes are allowed to get a B? Well, I would say, as a general rule, most of your sentences need to be accurate. Most of your sentences need to be accurate. And I'll just answer a question there someone's asking me. Someone's asking where can you find this task? And I'll just show you, everyone. Just bear with me one sec. So you can get it on the OET Centre website, this task. I'll show you where. So this task, everyone, is here. You can see that one there. So yes, just find that on the OET Centre website, everyone. And the same one, the next one is on the same page, everyone. So let's continue. Let's continue. So this is a nurse one, everyone, a nurse one. So this is a patient, and his name is Lionel Ramamurthy. Always read the notes, as I said before. He's a patient in the medical ward, and you are a charge nurse. Do we have any nurses here today? Any nurses? Type in just type in nurse if you're a nurse, or type in Y for yes. We've got the patient's name, Mr. and it's in a hospital, Newtown Public Hospital. Marital status, widowed. Spouse deceased 6 months. Living in a community retirement home. Lots of nurses typing in, well done. We've got next of kin. Let's just see who we're writing to first. Using the information in the case notes, write a discharge letter to Miss Georgine Ponsford, the resident community nurse at the community retirement home. The letter will accompany Mr. Ramamurthy back to the retirement home upon discharge. So he's writing, this letter is going back to the retirement home where this patient lives. So that changes the way we approach, because that means that if we're writing back to a retirement home, they already know a lot of information about the patient. They know that he's widowed. Oops. So a lot of stuff we're going to delete, everyone. They know this information. They know about the next of kin. They don't know about his admission date, though. That's new. They know about his past medical history, eyesight, social background. All of this past medical history is known by that residency, so we don't need to include it. The key here is to include information they do not know. They know about his medical history, COPD, and type 2 diabetes. So all of that is known. What's not known? Well, it says here, admitted with pneumonia, acute shortness of breath, and he's got wheezing, persistent cough, chest and abdominal pain, fevers, rigors, sleeplessness, generalized ache. So a lot of issues there. And on admission, he was mobilizing with a pickup frame. He was assisted with his activities of daily living, showering and dressing, but he was very weak, ambulating only short distances with increased shortness of breath on exertion. So that's all important because that's not known by the residency. They might have suspected pneumonia, but all of this information would seem to be quite relevant. So if you're writing a letter, you're going to include that information. You're not going to include the already known information. And that's the key to writing within the right word length. Camille, not bad. I'll talk about that in a minute. Nice introduction, nice try. Then medical progress. He's afebrile, the inflammatory markers back to normal, slow but independent, walk and shower and toilet okay, dry cough, some chest and abdominal pain, but there was weight gain following a review by a dietitian. So that all seems very relevant because he's progressed. Nursing management, encourage oral fluids, proper nutrition, ambulate as per physio review, so the physio has been involved, encourage chest physio, deep breathing and coughing exercises. So this is all part of the ongoing care. Sitting preferred to lying down to ensure postural drainage. So that all seems quite relevant to his ongoing needs. And good progress overall, that seems important. Discharge plan, paracetamol if necessary for chest and abdominal pain, keep him warm, and good nutrition. And his diet needs to be monitored. All right, so it's all the recent information that needs to be described. So let's look at how this student went with their letter. Now I'm going to start and I want you to give me, we'll start with the introduction. It says here, I'm writing to refer this patient, a 63-year-old male who is due to return to your centre today. What do you think about that introduction, everyone? I feel there's a few things missing. What do you think? Is this a referral letter? You're sending a patient back to where they've come from a aged care home and they're going back to an aged care home. It's not really a referral. Yes, Princey's got it. No purpose. So this introduction is not very good, everyone. It's just it's very general, almost like some pattern that somebody learned. Yes, no, it says it's missing the main medical issue. Yes. So we're going to have to rewrite that, everyone. I'll have a bit of a go. Someone already mentioned something, but we might say, I am writing to update you on the progress, because it's like a progress report, isn't it? On the progress of one of your residents, Mr. One of your residents, comma, Mr. Rama Murthy. How would we finish that, everyone? Does anyone want to finish that for me? Mr. Rama Murthy. That's what this is. So you've always got to think, why is it you're writing? You could also say, I'm writing to refer back. I like what Muhammad's got, who's recovering from pneumonia and ready to be discharged. Yep. That would work. I wouldn't say continuity of care so much, Frincy. So we want to mention who is, we might just say that, who is recovering, because he is recovering, who is recovering from pneumonia, who is recovering from pneumonia and ready to be discharged. So remember, everyone, when you write your introductions, it's got to be really clear like that. Now, that makes it a lot better. Patch says, has been diagnosed with pneumonia and needs your further care. It sounds a little bit funny to say needs your further care because he's going back to a residency. I wouldn't quite word it like that because they know what to do. Noah writes, who was diagnosed with pneumonia and is recuperating well. Very good, Noah. Mujim writes, admitted to this clinic with pneumonia, having made a full recovery, he is due for discharge. Yes, good use of that participle clause there, Mujim. All right. Mohammed writes, who is recently diagnosed with. Now that's a bit funny. That should be who has recently been. Use present perfect with recently. And the last one, Mira says, I'm writing to update you about your patient, Mr. Ramamurthy, who is due to be discharged today after making a full recovery. Yes, the only thing I'd be wary about that, has he made a full recovery yet? Or is he still recovering? But otherwise, that's very good. All right. Is there any comma after Mr. McMurthy? No, you could put a comma here, but I don't think it's really necessary because we've already distinguished between, we've got an A positive structure between the noun resident and Mr. McMurthy. And also it's a defining relative clause. So you use the commas with non-defining relative clauses, like when you're adding extra information, but here we're describing him who is recovering. So comma not required there. Okay, let's keep going, everyone. Initially, he was admitted, we can probably leave that in now without, it's not really a problem. Initially, he was admitted on this date with a diagnosis of pneumonia and was experiencing fever, acute shortness of breath, wheezing, and a persistent cough. He was very weak and had chest and abdominal pain. That's an excellent paragraph, everyone. Now, if I did this, we would change the introduction so as not to say pneumonia twice. So you might say who is recovering in our, let's just say ward, and who's recovering in our ward and is ready to be discharged. So you don't even have, it's good to put pneumonia in the introduction, but if we put it in the first paragraph directly after, that's still very good. So we can adjust it. The key is we don't really want to repeat everyone. So we don't really want to repeat. Yes, I agree with you, Hala. The purpose is to update about the patient's condition. Okay, so that describes what happened on admission. Now let's talk about hospitalization. During hospitalization, his progress has improved. What's wrong with that sentence, everyone? His progress has improved. While I'm waiting for your answer, Sarah says, did we include what we need the nurse to do? You've got options there. If you want to put the details, like a home visit or continue the care, you can, or you can save it for the conclusion there, Sarah. So you've got options. In this case, because you're referring back to you're updating on the progress, they know what to do. It's quite self-explanatory, and you've summarized their situation. Yes, his progress and improve have the same meaning. So I would say, if I was correcting this, I would say it's an incorrect expression. I would give some choices. So we've really got to say his condition has improved, or he has made good progress. But progress and condition have the same meaning. You could even say he has made steady progress, but his condition has improved. And he is no longer febrile, and the inflammatory markers are within normal range. That's from the case notes. However, he still has dry cough. I think we need something here. He still has dry cough. It's a type of cough. So we need something there. He still has dry cough with chest and abdominal pain, for which he takes paracetamol. So the medication's been mentioned. Yes, meaning he's still sick. So we can't say a full recovery yet. He has improved, but he's still getting better. Physiotherapy has been provided to help with mobility and breathing. Okay, let's fix up that. A dry cough, thank you, Sarah. And what about this error, everyone? Physiotherapy has been provided to help with mobility and breathing, and he can able to walk. Can able have the same meaning, so that's not right. Short distances and manage his personal hygiene. You could say is take or taking, they'd both be correct. He's made good progress, that's right, Raji. Rafi says, if we're referring our patient cardiologist, is it necessary to write about his nut allergy? Interesting question, Rafia. Perhaps it's a relevant history, the risk of anaphylaxis. Now, everyone's getting that one, is able to walk. Could walk, yes, but I prefer he is able to walk. That's how we would correct that one. So he is able to walk. I don't want to say could because I want to make this current, so something he can do. All right, let's keep going. Mr. Ramamurthy has been put on a specific diet implemented by a dietitian, and his weight gained 1.5 kilos. Now, there's a sentence that's not too good either. And his weight gained 1.5 kilos. Can anyone fix that sentence? Sometimes it's quite hard to write about weight gain. Sarah writes capable of, that's good. Hala says, do we need a comma before for which? No, you don't, not with preposition for, but you, again, you can put a comma. So to stress it, but I wouldn't say it's essential. All right, so just waiting for your answers here. He gains, no, the thing about weight, remember this has happened over a period of time. So for periods of time, we should use a perfect tense. Perfect tenses describe a period of time. He gained, everyone wants to use simple past, but I don't want to use simple past. I want to use a different tense. It's happened over time, over the hospitalization period. Not increased his weight, no. We do want to use present perfect though, so you're getting there. So he's been put on a has been, so that's present perfect. Has gained, I saw it come in. He has gained. So I would say by a dietitian, and here we're going to do this, everyone, and has gained 1.5 kg of weight. There it is, everyone. He has gained 1.5 kg of weight. Or his weight has increased by 1.5 kg. So you could say that as well. And his weight has increased by 1.5 kg. So lots of different ways to write it. Weight can be tricky, so always review that carefully. And we can't really say kilos because it's informal. So we've got to say kg, 1.5 kg of weight. Keep going. To ensure postural drainage, it is safer for the patient to remain in, this is an easy one, I'll do it, in a sitting position after meals. That was mentioned. In terms of his discharge needs, could you please encourage deep breathing and coughing exercises? So he's received some help for that, and they want them to continue that in the residency. So it's very good to be specific, everyone. Then it says, also, he needs to be kept warm and his diet needs to be monitored. What's wrong with also? My suggestion here, do not start a sentence with also. Where can we put the word also, everyone? It's got to go somewhere else. It's a good joining word. Moreover instead of also, says Muhammad. Now, someone asked that question before. What about furthermore and moreover? I would advise against using moreover. And I wouldn't use in addition either. It's not wrong to use it. It's not wrong. But your letter will flow better if you do what Jane did and Saint Ini did. He also needs to be kept warm and his diet needs to be monitored. So use also after the subject, all right? And before the main verb, which is needs, all right? If you have an auxiliary verb, he has also been something, something. So if you have an auxiliary verb, also goes after the auxiliary, but before the main verb. No moreover, no furthermore. I mean, furthermore, it's not illegal. You can use it in the right place, but it does flow better if you reduce those signal words. And that's it. He needs to be kept warm and he needs to be monitored. Things which need to be done. So we're using present perfect passive. Now, this time around, this is a good letter, everyone, but we saw that the purpose was weak. So this person is going to lose a lot of marks for that. Jane writes, lastly, he also needs to be kept warm. I wouldn't use lastly, firstly, secondly, not when writing to another professional. You don't need to order things. So I wouldn't emphasize it in that way. Ashwini writes, may I remind you? Well, you're not reminding the person of everything. You're telling them. So you don't really want to remind them in a letter. You want to avoid that. Okay. And so purpose not good. Content was quite good though. All the information was there. So I think, and it's, look, this is quite a strong letter, everyone. And it's 192 words. So it's really, it removed all that non-relevant past medical history. Genre and style, there were a few mistakes there in the way that it was written with expression. And I thought the organisation was very good, again, subject-based, but the language was the downfall. So the examples I've given you today, everyone, they're actually really quite good letters. It's only a few language mistakes that have caused the mark to come down. But I did just want to show everyone, I wanted to show some letters with good content because that's very important. And notice how they're both within that word range. I think that's quite important with the new updated writing criteria. I don't think it's a good idea to write long letters, especially over 250, or, you know, try to keep your focus narrow so you can, you know, stay within that 180 to 200 or not go much over. So that's all about your planning and removing non-relevant information. All right. Well, we started a bit late with our little bit of a technological glitch, but we've got there in the end. So now it's just a time for a few questions from the audience. Jane says, for discharge, should we arrange according to order of importance? I think so. I think that's what we've done here. Straight on to the pneumonia and the natural progression. So yes, that works. Someone says, can we use hence? Can use hence. It's a bit like therefore if it's used in the right way. Can we use it to recommend? I can't quite get that, Frincy. It is recommended to keep. Yes, you can. Good sentence there. Sarah says, certain connectors are not good to use with new writing criteria. Moreover, furthermore. Yes, I probably would avoid the moreovers and furthermore. Sometimes it can be correct, but sometimes not. So just be careful with those words. And when in doubt, leave them out. Mohammed says, what's the score of this letter? I think it's in the 300s, but it's got a few areas to work on. So it wouldn't get a B because of those quite a few errors there, but it's still not a bad letter. That's just mine, but you've got to see what your OET Centre does. But using the criteria, I'd say it's a little bit below. Yes, and that's a good point. I missed these ones. These commas need to be added. This one left out the commas, so losing a bit of mark for the punctuation, and there were some mistakes up here too. So when we start looking at other things in style, that would reduce the marks a little bit as well. So attention to detail is important. Noah says, should we mention the patient in every paragraph? I didn't put it here, Noah, because Ramamurthy was mentioned in the previous sentence, but I think it's a good idea when in doubt to start each paragraph with the patient name if it hasn't been mentioned for a while. Tunde says, what if the information given is too long? Should we still maintain? If the information is long, Tunde, then it just means there's more non-relevant information. So don't be afraid of long letters. It just means there's more to omit and more to summarize. Jai says, regarding the grade, how many strong and satisfactory do we need to get a B? Look, I would tell you in this exam, if you get needs work, even on one category, it can be enough to pull your overall score down. So you don't want to get a needs work, and this is just our category. That's just a general guide. We're not, they have the OET Centre used a more detailed 1 to 7 point scoring system. This is a general guide, just to give you the idea. All right. Can we use past simple during hospitalization? Yes, you can use past simple to describe the initial condition and then present perfect to describe the progress. All righty. Well, look, we've run out of time, everyone. We've run out of time. We started a bit late, but we got there in the end. Thank you for waiting, everyone. I'll just tell you briefly, don't forget, if you've got an upcoming exam, you need preparation, we have excellent writing courses for all professions. We have doctors-only writing classes, we have nurse-only writing classes, and we have allied profession-specific writing classes. So no matter what your profession, so we've got 3 writing classes plus our grammar classes. So if writing is your weak area, we can certainly help you. And of course, we have courses for not just writing, speaking, reading, listening, whatever area you need help with. And we've got our virtual classes running at time zones suitable for all. So don't forget, if you want actual support, visit our website, choose one of our courses. You'll be glad you did, and we'll help you prepare for the OET exam. Now, I'm going to end this session, and we will see you. I'm going to end this session now, and immediately after, I'm going to do an orientation. So stay on the Facebook page, and I'm just going to tell everyone about our virtual classes, which start on November 11. If your exam's on November 9, good luck, everyone, and fingers crossed for a good result. Bye for now. Don't forget, switch over to the other video. It's going to start in a few moments, where I'm going to talk about our virtual classes. It's an orientation. Bye for now.